If the government had hoped the promise of a plane load of masks, gowns and other personal protective equipment, or PPE, from Turkey would take the issue out of the headlines, it has had the opposite effect.
We're working to resolve the Turkish shipment of PPE as soon as possible, following some unexpected delays at the weekend. Today, we have unloaded a shipment of 140,000 gowns from Myanmar.
Ministers had said on Saturday that it would arrive on Monday. So far, that has not happened. And it was never going to fill the large gaping hole of gown shortages. It is the equivalent of 3 days' supply for England. Gowns were, in fact, never included in the pandemic preparedness stockpile. And resolving this shortage has been made more difficult by global problems. On Friday, Public Health England issued an alert suggesting alternatives, including using lab coats. But this is not the only shortage. Across the country, patients are lying in intensive care units on ventilators, tubes put into their airways to help them breathe. Now it has emerged the drugs used to relax their muscles, to allow them to be intubated, are in short supply. The NHS has issued an alert saying there are now limited supplies of 3 muscle relaxants, or what are called neuromuscular blocking agents.
Our conversations with the Chief Pharmaceutical Officer at NHSE about a week ago, we were assured that there are supplies for the coming 2 to 3 weeks, and that they are resourcing further supplies from the manufacturers.
The alert from the Department of Health and Social Care and NHS England says, for instance, stocks of cisatracurium in the supply chain are critically low and restock is not expected in the near future. Doctors have been told to use other drugs to help preserve what is available while they source further supplies. And another critical shortage looming is rehabilitation. Specialists are warning today that almost all patients who have been in intensive care will need help after leaving hospital.
People who are recovering from COVID-19 are going to have a variety of different problems, physical problems and also neurological problems. So they're going to be an awful lot weaker than they were going into the disease. They may have problems with balance, speech, concentration, poor memory. There are a variety of problems that can be helped, providing they get access to suitably trained rehabilitation therapists.
But rehabilitation services have been cut over the years.
Rehabilitation following critical illness has been under-resourced in this country for some time. So we're fully aware of the problem, and we're fully aware that there are considerable needs that need addressing.
This is Headley Court in Epsom, Surrey, once a centre for British Armed Forces veterans who'd lost limbs or were suffering from post-traumatic stress. It was later bought by a private developer who has now handed it to the NHS and local council, primarily for recovering COVID-19 patients. It has taken just 2 weeks to put in the electricity and power supply, a sign of the urgency.
We think the need for rehabilitation will be quite large because a lot of people who survive COVID are going to have they'll be quite decompensated and have quite a lot of breathing difficulties and are going to need a lot of rehabilitation before they can get back to normal life. So we think this will be an important facility, particularly over the summer and the winter for the NHS.
It will take 150 people from May and will have the capacity to treat 300. A recognition that leaving hospital, coming out of intensive care, is far from the end of the story.
In 2 weeks.
Well, Victoria joins me now. And Victoria, you've got an update on that plane carrying PPE, haven't you?
Well, we're not carrying PPE, not yet, because we understand that it has, in the past couple of hours, finally left Brize Norton on its way to Turkey. So the likelihood of it getting back tonight in time for the Monday promise that we'd had, I would say not too sure about that. We were told that there was some paperwork problem. I think what it has highlighted, however, is the issue of the government making these announcements. They seem to want to make an announcement at every Downing Street press conference, making promises that sometimes don't stand up to scrutiny, or they haven't quite anticipated that there might be problems. And let's think about the testing. testing, 100,000 a day tests by May, by the end of this month. And what were we at? Yesterday, there were just over 19,000 tests carried out. So it is very hard to see how in just over a week that they're going to reach that target. And I think that there does come a point where ministers might have to just tell the nation what's really going on and what they can and can't achieve, and particularly with things like PPE and drug shortages, as I said in my piece, and now the testing as well.
We'll wait for that moment. Victoria, thanks very much. Well, already more than 50 NHS staff have lost their lives after contracting COVID-19. Dr. Abdul Chowdhury was one of those who died. He'd written to Boris Johnson complaining about the lack of PPE for NHS staff. Meanwhile, another NHS doctor has taken her campaign about lack of PPE to Downing Street. Meenal Viz is a pregnant doctor working on the front line in the fight against COVID-19. But this 27-year-old has launched a one-woman protest because she believes there isn't enough protective equipment, and that's putting her life and that of her unborn child at risk.
They need to be more transparent as to how they plan to protect us over the next few weeks.
Dr. Viz says she's raising the critical issue of lack of PPE on behalf of all frontline NHS staff. She claims many are being asked to work with COVID patients even when they don't have adequate protection. This weekend it emerged that doctors and nurses are now being asked to work without protective full-length gowns. Under new government guidelines, frontline staff were told to use plastic aprons when gowns ran out or reuse PPE, even if they fear this may lead to more of them contracting the virus. Her own experience as an NHS hospital doctor treating COVID patients has made the issue a very personal one for Dr. Viz. Here she's a lone protester, but her plea for proper protection will resonate with many frontline workers. Well, earlier I spoke to Dr. Viz and I began by asking her why she was protesting.
If I was given the right protection, if I was given the right information, I would run a marathon for my patients. I would do everything in my hands to help and serve our society. But I cannot put myself at risk or my unborn child at risk due to the negligence of the government to protect us.
I mean, the government says that it is making, quote, a singular effort on protective equipment, on PPE.
We're running short of basic protective gear, everything, masks, gowns, aprons, and our guidelines are being changed according to the supply we have.
It's reported that some within NHS England believed that full PPE, including the gown, was excessive and that the new guidelines are in line with the WHO recommendations. What do you say to that?
Well, I've seen my colleagues in Italy, I've seen doctors in China, doctors who are not even working in COVID areas, who are working in the hospitals, are still wearing the full protective equipment. And why is that? We reported last week on a nurse who was pregnant and who tragically passed away, and her baby was delivered by caesarean section. What toll does it take on you that you're being told to work when you're in a vulnerable group? We don't have enough evidence to show how COVID can affect a pregnant woman or unborn child. And after what I saw last week, I couldn't sleep knowing that this woman has left a newborn baby behind, and this newborn baby will never know her own mother. Dozens of NHS staff we now know have died after contracting COVID-19. What impact has that had on you in the last few weeks? Knowing that our colleagues have passed away in the very same hospitals where they were treating COVID patients, and yet managers are still telling us that these people could have caught the infection in supermarkets. How is that okay? It breaks my heart to know that these deaths are not being taken seriously. Now everything is becoming a statistic, everything is becoming a number, and my biggest fear is that this becomes the new normal. Boris Johnson, when he emerged from hospital, thanked the nurses and the doctors who'd cared for him by name. Was that a comfort to you? There's a lot of distractions from politicians, a lot of distractions from the government, where they're saying, clap for the NHS, or bring out a new badge, or let's praise all of the public who are fundraising for the NHS. This was their responsibility. No amount of claps, no amount of money is going to bring our healthcare workers back, or even all of those people who've lost their lives so senselessly. You're angry, and that anger goes right to the top, to number 10. Yeah, and it has to, Kathy, because I want to make sure that we all speak up now, because we're not speaking up to that extent. It might just be that the politicians feel that we are afraid, but I want to let them know that we are not afraid.
You talked about how you'd run a marathon for your patients if you could. Do you worry that you're facing a choice between protecting your life and saving theirs?
No doctor should be in any situation where they have to decide if they should put their patient or themselves first. But we are in this situation because we haven't been protected and we haven't been given the right equipment to deal with it.
If the Prime Minister was in front of you right now, what would you say to him?
I would ask him to apologise, firstly, to all the families who've lost their loved ones. I'd ask him to justify and to be honest about why he let this happen, and I'd ask him to be honest in how he plans to protect all the healthcare workers across the country. I want justice to be served. I want justice to be served to everybody who's lost their lives, to the healthcare workers who are suffering right now, and to all of the families of these healthcare workers who've lost their loved ones in such a tragic way.
Well, in a moment, I'll talk to Labour's Shadow Business Minister, Lucy Powell, who's in Manchester. But first, we're joined by the chair of the Commons Defence Committee, Conservative MP Tobias Ellwood, in Bournemouth. Tobias Ellwood, you heard Meenal Viz there saying she hadn't got the right equipment, that she believed that Boris Johnson owed her and other families, grieving families, really, an apology. Do you think he does owe them an apology?
Well, I think the Prime Minister and everybody regrets any loss of life, and that was repeated by the Chancellor today. We need to do everything we can to make sure that the front line has that equipment. We need to recognise that we're competing with the rest of the world for the very same equipment, and we don't have that indigenous capability. That is now changing with Lord Dayton, who is now part of our procurement process to make us so we can have that capability.
Should that have happened earlier?
Absolutely regret. I'm sorry?
Should that have happened earlier, do you think?
Well, we take the advice from the scientists. There will be many questions, difficult questions that will be asked in the future. There will be a Chilcot-esque type inquiry, no doubt. My interest is what happens next. What the government has been very good at and very clear is that critical message of what the nation needs to do for us to get on top of this virus, to stay at home, to protect the NHS and to save those lives. It is the fact that people have addressed that. It is also the fact that this government has worked hard to build up the NHS capacity that's allowed us to save lives. But I don't shy away from the absolute magnitude of the challenge that we face, not too dissimilar to Spain, Italy, France, and dare I say Germany as well, because although Germany's numbers are much lower, with respect to Germany, they are counting in a very, very different way. All these countries that are very similar in Europe are going through a very, very similar challenge.
We've reported tonight not just on the shortage of PPE, but the shortage of drugs for ventilators. I'm just interested, you've been in the army, and I just wondered how you thought that the government's response to this crisis bears comparison with the kind of thing you've experienced in the military.
I'm not in government and I'm not in the room, so I can't see what happens. I can say that from the outside that the traditional cabinet-led government isn't good in a crisis. It's tried, it's tested, it's reliable, but it's very time-consuming. It's very cumbersome in its decision-making. Enduring crisis management requires good command and control and communications, simple decision-making structures, situational awareness, and strategic assessment. We have to learn quickly about the adversary. We have to establish what you might need to fight it. We've just been talking about that. And there has to be a plan of action. Grow the NHS capacity, procure the kit that you need, lock down the country, ensure that you've got the economic intervention, and of course to support those jobs, but ultimately the clear messaging as well. My interest is what happens next. The country is more educated, it's more disciplined. It wants to know what's going to come around the corner.
Well,
we want the Prime Minister to get better, but that he's the best communicator in government. We really want him back.
Right, well, that's interesting that you say, you know, he want him back. Is that an admission, then, that from where you're sitting, it doesn't look like the government has communicated sufficiently clearly about what does come next in terms of exit from the lockdown?
Well, There hasn't been a requirement to date. They've been very, very clear what those tests are. We must avoid a second spike. We must make sure that NHS can continue to cope. We must get those deaths down. And it was great to see that those numbers, tragic though everyone is, has been reduced. But yes, I think it's now time for the Prime Minister to spell out what actually happens next. We saw some hint of that, but I don't want to pick up stories or leaked suggestions in the Sunday papers. I want the Prime Minister to say, this is our intent. This is the direction of travel. The nation is right behind him, and they'll continue to be so if they're kept on board.
And just very briefly, are you content that the government spends whatever it takes to continue lockdown indefinitely? Or does there come a point when that is just too costly, both in terms of the economy, but also in terms of the mental and physical health impact? And
that is the absolutely crucial question to ask. How do you, firstly, keep the nation on side, but ensure that there is an economy for us to pick up the end of this, but ultimately get on top of the challenge of spreading with the virus itself?
Tobias,
I would like to see...
Tobias Ellwood, I'm sorry, we've run out of time, but thank you very much for those thoughts. Thank you. Let's turn now to Lucy Powell, Labour's Shadow Business Secretary. You tweeted today, just picking up on that final point about the economy that Tobias was making there, you tweeted that the government must reassure pubs that they'll do whatever it takes to support the sector. In your view, does that apply across the economy?
It does apply across the economy. And the reason I said it about pubs today was that there was as Tobias just mentioned there was a front page splash in one of the big newspapers that pubs could be closed until Christmas. Yet yesterday on an equally big newspaper, we had a splash that schools would be reopening in 3 weeks. And I think this just really isn't acceptable. We can't have these kind of confusing and worrying briefings of different kinds coming out to the national press. That's why we need a more transparent and open approach about what the exit strategy is, how that will be phased, what sectors will or won't be in the early phases, when might those later phases be, so that the public and businesses can plan around what is such an uncertain and difficult and worrying time for many.
But to be clear, does public health come first here, and that really you're content that the government opens its chequebook and worries about the ultimate cost of that down the line?
Well, yes, to some degree, because, yes, of course, public health comes first, and we support the government completely in its decision to extend the lockdown, and we will continue to support them as long as the science advises that is necessary. So we are with the government on that. But what we know from previous recessions, and this could be, unprecedented, doesn't even kind of suffice, does it, as a word anymore? But what we know is the more that we can incubate the economy during this time, the more we can keep businesses alive during this time, then the faster we'll be able to bounce back when the lockdown does end. And that's why it is important that the government has said they do whatever it takes. And so they really now need to follow through with that and make sure that the money and the support is getting to businesses.
So does that incubation, as you put it, extend to a business like Virgin Atlantic, for example, Sir Richard Branson's business?
Well, look, I think where it comes to those big businesses, I think the government needs to take a different approach, either some sectoral approaches, because there are big, important infrastructure sectors that are going to need some extra support, and maybe they need to look at other solutions there. But I think
he shouldn't get a loan? Just to be clear where Labour stands on this?
Who shouldn't go alone?
Well, should Richard Branson get a government loan? Virgin Atlantic, he's worth over $4 billion.
Well, look, if he can apply for a loan, and he may well get a loan. I don't think what he's asking for is actually a loan. I think he's asking for more than that. But look, I think the loan scheme itself, there are companies, big companies like Virgin and others who can't access that. There are very small companies who can't access the loan scheme. And many of those that would qualify for the loan scheme are finding themselves turned away from that loan scheme because commercial terms are being applied. That's why we've said that scheme should be 100% backed by the government, not 80%, which is what the Governor of Bank of England and others are saying as well.
OK, Lucy Powell, thanks very much for joining us.